So you want to go to nursing school? Let's talk about this. Hello, my name is Ray, and I am a registered nurse, or RN for short. In today's video, we are going to talk about getting into nursing school. I'm going to take a different approach. If you are considering becoming a nurse, either a licensed practical nurse, licensed vocational nurse, or registered nurse, some advice I would tell you to do before you even look at nursing schools is to look at your state board of nursing. Let's say you live in Florida, look at the Florida State Board of Nursing. If you live in Texas, look at the Texas State Board of Nursing. Look to see what criteria is needed in order for you to take the NCLEX to become a nurse. There are certain things that you must meet in order to be eligible for testing. So I would advise anyone to look at the criteria first before you even apply to nursing school. There are certain things that you can't have on your record, like certain criminal convictions, felonies, things of that nature. So look into that first before you apply. Also, while you're on the website, look to see what schools are accredited in your state. There are some schools that are online, which may be accredited in some states and not in others. So you don't want to attend a nursing school that's not accredited in your state, because you can attend the nursing school, but guess what you can't do? You can't take your NCLEX. So you've gone to school for nursing, but you can't become licensed as a nurse in that state because of the program you went to. So look to see what program is accredited in your state and apply to those schools that meet the criteria for the State Board of Nursing in your particular state. I'm looking at a local nursing school. Some of the criteria is different than the school I attended, but it's basically the same. First and foremost, there is an entry exam that you need to take. It goes over, let's see. Let me just look it up and tell you. A lot of nursing schools use ATI, and the test that they use for nursing school entry is called the TEAS. And some of the areas that you will be tested on, I'm just looking it up for you guys. I took it, but Lord, it was years ago and I can't remember. I know there was math on it. Okay, so it's vocabulary, math, analytical reasoning, spelling, reading, natural science, and vocational adjustment index. I have no idea what that is. But those are the areas of study for your entry exam. And then each individual school that's accredited in your state, don't forget that, will have a certain criteria that you need to pass. Like you may need to receive like a 70 on the exam, on the nursing entry exam, in order to get into nursing school. So once you've taken the nursing entry exam and you pass that, you can start taking your prereqs. So what you're going to take, and this, I'm looking at one of the local schools here in my area. It's an Associates of Science. So I'll tell you those criterias, and then I will look at a local four-year college in my area and tell you what the criteria is. And again, like I said, look at the schools that are accredited in your state to see what those criterias are in order to finish nursing school. But a lot of schools have the same criteria. So there are two different types of degrees. There used to be three. I don't know if there are any diploma programs out there. I'm not sure if they are still in existence, but the most common ways to become a registered nurse is through an Associates of Science or a Bachelor's of Science in Nursing. So a 2-year degree or a 4-year degree. Either one, if you go to a 2-year college, you're still eligible to take your NCLEX exam as long as you meet all the criteria. And the same for a Bachelor's of Nursing. As long as you meet the criteria to take your NCLEX, you can take your NCLEX. For one of the local associate programs in my area, the criteria is the nursing, the pre-entry nursing exam, human anatomy, microbiology, chemistry, English, psychology, either anthropology or sociology, and a communications class. Hey, I had to take a math class. I had to take more classes from my school, but oh well. So this is for a 2-year degree. And then I'm just looking, the nursing schools, it looks like it mirrors the criteria for NCLEX. Remember I was talking about a conviction? This nursing school mirrors our state board of nursing. So you can't have certain criminal convictions. If you have certain criminal convictions, you're not able to apply for the nursing school. They will do a background screening, drug screening, and a health clearance. Usually they want like your immunization record. Okay, so I'm looking at the actual nursing classes. Usually you take your prereqs first and then you take your nursing classes, but it varies by school. The school that I attended, you had to take your prereqs first and then you started taking your nursing classes. But in a 4-year college, you take your prereqs in at the same time you're taking your nursing classes. But I want to say the first semester you need to take a lot of your science classes. So this particular nursing school, you have Introduction to Health Careers, and then you have a skills lab. So in the skills lab is where you learn your nursing skills. Like you learn how to put in IVs, you learn how to do a physical assessment. They have, at my school, it was like just rolled out. They had like these mannequins that had lung sounds and heart sounds. So you would learn how to do an assessment on the heart. They had different heartbeats that you could hear. You learned how to place your stethoscope to hear the different areas that you need to listen to when you do a physical assessment on the heart. And then also the lungs, the mannequins had lung sounds, and there's certain places you need to place your stethoscope in order to hear lung sounds. So that's what you learn in skills lab. Oh, and all types of other things, like there's certain procedures you need to do as a registered nurse. Like if, let's say, you need to do something that you have to be sterile in order to do this procedure, you learn how to do sterile technique in your skills lab. I'm holding my hands up like this because this is part of sterile technique. And once you know, if you know what I'm talking about, and I'm sure the people out there who are in the medical field know what I'm talking about, holding your hands up like this for sterile technique. So you also learn how to place Foley catheters. You learn how to insert an NG tube, a nasal gastric tube, all kinds of things, all kinds of skills that you need to know as a nurse, you will learn in your skills lab. And then you have fundamentals of nursing. With that class, you have a clinical. So not only do you have a skills lab, you have clinicals. Clinicals are when you go to different medical settings in order to learn clinical skills. Like usually your first clinical is when you learn how to do like basic things like bathing a patient, taking vital signs, a physical assessment on patients, charting, and then as you progress, you start doing more and more in your clinicals. So you'll have your actual nursing class, your skills class, and your clinicals. And you'll have an instructor for each class. So with clinicals, at least when I did it, we would, like if we had clinicals in a hospital, I had to go to that hospital the day before. My clinical instructor would assign me to a patient, and I had to go into that patient's chart and look at everything that was going on with them, like laboratory values, their vital signs, what they're in for, test results, the expected outcomes. I had to know all of that for clinicals. So when I had clinicals the next day, I had to present my patient. What I would do is, depending on what class it was or, what my level was, I would, do the basic things like Bathing, if they needed help bathing, toileting, I would do my physical assessment and I would pass medications. Now, either I'd pass medications with the nurse, but usually it's with your clinical instructor because you need to know what medications you're giving. So you have to give like an explanation of the medications and why you're giving it. And then you need to tell this to the patient too. So then it looks like for this particular nursing school, there's medical surgical nursing 1. So in your medical surgical classes is when you learn about different systems in the body, the neurological system, the GI, gastrointestinal system, cardiac, renal, respiratory. So that's when you learn like the meat and potatoes of nursing school. And then there's some other classes that are separate from that, which are their own class, which is maternity child nursing, which it looks like with this school is you have 2 classes. So you have maternity child nursing A and maternity child nursing B. So for me, with my nursing school, it was separated. Like you had maternity by itself. And then, so this one is saying maternal child nursing. So it was pediatrics. So I had maternity by itself, and then I had pediatrics by itself, and clinicals for each one, and a skills lab. I don't think I had a skills lab for pediatrics. I did have clinicals for pediatrics, and I definitely had a skills lab for maternity, for OB maternity. And then mental health is a class on its own, and it was the same. So they have a mental health class in this nursing school, and mental health was separate for me when I was in nursing school. Pharmacology is where you learn about all the different medications, because you have to know your medications in order to administer them to a patient. You have to know what you're giving, and you have to know side effects and what the medication is for to give to patients. And also, when you're giving a medication to a patient, you need to educate them on what the medication is and what it's for, side effects. Certain medications, certain common medications, you'll know the side effects off the top of your head. And if not, there's usually a side effects teaching sheet that you want to give the patient and explain it to them. And then it looks like there is a professional role development. That was a class I took that was the class that I took in nursing school, my very last nursing class, where it talked about different careers in nursing. It talked about like how to delegate, like nurse management, different areas of nursing you can go into. I couldn't remember that, but yeah, that's what that class was. So, and then you also have a preceptor course where you are assigned to, it's usually a hospital. You are assigned to a nurse preceptor, and you do clinicals with that nurse preceptor. Basically, what you're doing is you're taking like a patient. You do everything for that patient that a nurse would do. You do your assessment. You do any bathing if they need it, any procedures that nurses can do. You do medications, and you take care of that patient for a whole shift. And it's a certain number of weeks. So yeah, that's what I did my last semester in nursing school. I did my preceptorship, and I had that professional role class, professional nursing class. And it looks like that is it for this particular nursing school. And like I said, this school is a 2-year program. So let's look at a 4-year program that's in my area. Okay, so I'm looking at a 4-year college in my area, and the criteria is your first year is considered pre-nursing, which is your freshman year of college, and the classes that you will take are human anatomy and lab, chemistry, effective communication, and introduction to psychology. And then your second, that's a lot of classes. Oh. Well, I guess not. It's 4 classes. Okay. It just seemed like a lot when I was reading it off to you all. And then your next semester, you take human physiology lab, civic knowledge and engagement. I guess that's like a history class. Effective communications and artistic and creative expression core course. That's probably like an art class or a music class, or like, you know, that's probably like an art or a music class. Don't quote me on that because, yeah, that's what I'm assuming. And then it looks like your second year, your sophomore year, is when you start taking your nursing classes. So you will have the nursing fundamentals lab. Remember I talked about the skills lab? So you'll have that. Health assessment across life. Okay, so pathophysiology and pharmacology. Oh, so pathophysiology, I didn't talk about that, but in the 2-year program, you learn about pathophysiology in your med-surg classes. And what pathophysiology is you learn about different, how can I explain it? Like different disease processes and what it does to the body. Like you learn about diabetes and what it does to the body. You learn about high blood pressure and what it does to the body. And then pharmacology, again, is where you learn medications. And then it looks like you have your microbiology class with lab. I forgot about this. With anatomy and physiology, you also have a laboratory portion, and you have a lab with microbiology. And then, so your second semester of sophomore year, you have your medical surgical class with the clinical. You have geriatrics foundations with a clinical, statistics, and you have nutrition. So in 2-year programs, you usually don't have those types of classes. Like you don't have statistics. Nutrition is kind of built into your med-surg classes, especially when you learn like the gastrointestinal system. You talk about nutrition with that. But in the 4-year program, those are separate. Like statistics and nutrition is separate. When I went back for my 4-year degree, I had those classes and I had to take those classes. Even though I had already, not statistics, but I had already knew a lot about nutrition because of my medical surgical classes, but I still had to take it for the, you know, I still had to take it in order to earn my BSN. So be it. So the 4-year program, your junior year, you take medical surgical 2, psych, mental health, nursing. Both of these classes have clinicals. You take your second pathophysiology and pharmacology class. And then it looks like another prerequisite class. They have like a funny name for it, so I don't really know. But I'm thinking it's another prereq class. And then your second semester of junior year, you take maternity, newborn, child and family nursing. You take an NCLEX preparation class, and you take another elective class. Your senior year of this 4-year program that's in my area, you take your medical surgical 3, community health and nursing, nursing research and senior thesis, and then you take another prereq class. And then your last semester of your senior year in the 4-year program, you have nursing. You have, I had coffee today. Let me say this again. Okay. Your senior year, second semester, your last semester in the 4-year program in my area, you take leadership nursing care management, and you do your second NCLEX preparation. And then you have another elective class. It looks like you need to take 2 more electives. But you probably could take summer classes and get those electives out of the way. And yeah, so that's a 4-year program. So like I said, the 2-year program, you usually take your prereqs first, and then you take your nursing classes. The 4-year program, you're taking your prereqs and your electives along with the nursing classes. So yeah, so that's pretty much what you have to do to get into nursing school. So I was thinking I'm going to make a video about the different types of nurses. I think that would be very helpful. And I hope you found this video helpful. Like I said, nursing is a great career. There's so many different things you can do. Take a look at, I guess up here on this side, take a look at this video about different areas you can work in as a nurse. There's so many different areas, and actually after I edited that video, there are a lot of areas I didn't talk about, like nurse management, corporate nursing, all types of things. Nursing leadership. You can become a nurse professor. Like, you have to be a nurse to teach nurses, so you could do that. There's all types of things you can do with a nursing degree. You don't just have to do patient care if that's not what you want to do. So anyway, thanks for watching my video. I hope this information is helpful for you. And if you have any questions or comments, put them below. Let's talk about it. Thanks for watching.